Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video we're going to go over the 5 things that nurses hate. Nursing overall is a great profession to go into, but just like with any job, you're going to have your likes and your dislikes. Now, after talking with many nurses and from my personal experience, I've came up with 5 things that us nurses just do not like. I wanted this video to be fun and just enlighten you nursing students or new nurse graduates about some things that you may encounter that may get on your nerves. So let's get started. Number 5, abusing the call light. Call lights are a great thing. They let us nurses know when our patients need something and they can have quick access to us. But there is a difference between using a call light for a genuine need versus 5-star concierge service. Let me explain. Many nurses and myself have had people use the call light, specifically extended family members, to request for the nurse to bring them a snack or some coffee whenever the snack machine and the coffee machine is just down the hall. And you have to remember, the nurse is busy. They're running up and down the floor, so are the clericals and so are the CNAs. So needs like this are not genuine needs compared to something else that a patient may need. So that's one thing that may drive us nurses just a little bit crazy. Number 4, the full moon. Now, if you're one of my subscribers, you know that I just recently released a video on full moons and how it affects patients' behavior. So us nurses, we generally don't like working whenever we know that a full moon's coming or it is a full moon, because for some reason, some unexplainable phenomenon is that our patients start acting a little bit more crazy. We start getting crazy admissions, there's increased code blues, and things happen that normally wouldn't happen. So definitely full moons are not our favorite. Number 3, people abusing pain relievers. In the nursing profession, we want to take care of all of our patients' needs. And one of those needs we want to meet is providing pain relief. In nursing school, we're taught that a patient's pain is what the patient says it is. However, some patients have used that as a manipulation tool to get more pain medication when it's not necessarily needed. So as a nurse, that becomes very, very frustrating, especially in the times when you have a patient who maybe isn't doing good, they're coding, and then you have your other patient across the hall who's on the call light every 4 hours on the minute asking for their pain medicine. And you go in there and they're laughing, they're talking on the phone, they're texting, and you ask them, what's your pain rating? I have your pain medicine as you requested. And they're like, it's a 10. So that can be very frustrating as a nurse. Number 2, dealing with ego. Healthcare is about teamwork, and as the saying goes, there is no I in team. And whenever we take care of our patients, we must all work together. But however, as a nurse, you will encounter coworkers who have higher degrees than you or a higher status than you that will treat you with disrespect and not listen to your opinions at times. And this can be very frustrating. And finally, number 1, being short-staffed. To me, this is definitely number 1. This is one of the most things I hated hearing coming in for my shift. The night shift would tell us, hey, just to let you guys know, you're a nurse short today, or you're 2 nurses short today. And you know what that meant to me? I'm gonna have a lot more patients, there's gonna be a lot more chaos going on, and my breaks, probably not going to get as many breaks as I need. So being short-staffed is really a big thing for us nurses because we want to provide excellent patient-centered care and give you all of our attention. And whenever we're short-staffed, we have more patients, we have more responsibilities, and this really interferes with that and stresses us out. But sometimes you can't help being short-staffed because people get sick, people call in, and they can't get anyone to help you. But that is definitely one of the most frustrating things as being a nurse. So those were the top 5 things that nurses hate that I wanted to share with you guys. Now in the comment section below, please feel free to comment, you nursing students, nurses, about things that you don't like or things that get on your nerves. I would love to hear from you. And thank you so much for watching, and please subscribe to this YouTube channel.